Okay, guys, we just posted a video on the procedure I just did, which is a peripheral artery disease video. Basically, I was opening up an artery, and I'm going to react to it and actually give commentary on it so that you can understand what I was actually doing during that video. It's kind of like a procedure where I was just kind of going along, and I realized fully that the viewers might not understand what I did in that procedure. So I have a patient. The patient was actually a diabetic patient with clogged arteries. So if you imagine just an artery completely blocked and filled with calcium, just blocked, and because it's blocked, the road for blood to get to the foot is completely blocked, so the blood can't get to the foot. This is one of the most common reasons why people lose their legs is because they don't have enough circulation to actually supply nutrients and blood flow to the foot, and so the foot dies. They get a sore or an ulcer, and then it gets infected, and then they get an amputation. Smoking and diabetes are the top two reasons why people get sores in their foot or an amputation in their foot. So this is a very, very important and passionate topic of mine. I really love doing these procedures because I can actually prevent people from having amputations. So I'm gonna run the video. I'm not a tech guru. I don't have an engineer right now over here with me. So bear with me. It's not gonna be perfect, but at least it'll be educational and I can get through it. Okay, so let's start.
B stick, 1, 2, 3, pinch. Another pinch.
So first, you can see me kind of going into that foot, and you see me kind of injecting some lidocaine through a portion of the foot. I get access with a needle, and then I get into that artery. I can pass a wire through, and then I place a sheath. That thing I'm about to inject right now is a sheath. It's a tiny little device or tube that allows me to go in and out of that artery, um, without having to poke the artery several times. It basically creates a permanent path, or not a permanent path, a path for me to continue to get into that artery. So right now, I'm just checking to make sure I'm in the right place. That's why I was aspirating blood. And now you can see me, you can see that wire and catheter. I'm inside the artery right now, just trying to see if I can get through and get to the blockage. So I hit a roadblock here. That's why as you can see, I was passing that tiny tube in and that wire, but I hit a roadblock and I couldn't pass it anymore. I couldn't get it to go further, and because of that, I started to inject some dye. We call it contrast, but it's basically some dye, and I found out that you see this wiry little vessels here. That shows that that's not a real anatomical look of a vessel. Vessels are supposed to have they're supposed to be straight. They're supposed to be, they're not supposed to have all these feathery lines, these basically disorganized lines. And right now you can just see basically nothingness. I don't see a straight blood vessel going straight up or straight down. So this is basically what a blocked artery looks like, or blocked arteries look like. So my goal is to try to get that open again. So kind of burn this image in your head. We're gonna try to get past it. So the goal of this is I'm trying to get the wire I pass through it. I'm trying to get that to go all the way up, right? From your foot all the way up to your chest. If I can get my wire up, I can get the artery open. Um, so because when I get my wire up, if I can get my wire past the blockage, if I can get the truck past the roadblock, I can do whatever I want with it. I can if it's a lot of snow, I can plow it. I can do whatever, right? But I need to get through that blockage. And so right now I am working to kind of get that done right now. As you can see, I'm still working through it. You can see my wire is just there, just kind of hanging out. So I'm gonna try some techniques to get it to get it open. So I'm gonna unmute it.
Please go.
So I'm like begging the wire to go. You got to make the wire your friend. And so I'm basically, my tool is my wire. And you can see I'm trying, I'm working.
That's not what I want. Okay.
I'm not really happy about where it was going.
There.
So
There.
I changed the curvature of the wire. But, you know, you can't learn that
So now.
in a classroom. You know, you learn it by experience. And I've done just hundreds and hundreds of these, maybe thousands actually. And so now I was able to get my wire up. So now that I got my wire up,
Did you hear us praying? How
I can do whatever.
praying there in their OR. No, lower.
And then I'm just talking about
To our
that I
real
pray.
sister.
I pray in every case. I pray in my cases so that, you know, God can help me. So you have to always stay humble with these cases because I just feel it's not my power.
Let's see where we can get with this. So technically speaking, this is where we need
So
to
now here is it's important to know that the blockage that got me to put this patient on my table for a procedure was actually the blockage up here. This is like the mid thigh. So the blockage here was what I saw on the ultrasound. The stuff I saw down below, I didn't really appreciate it on the ultrasound that was done in the clinic before the case. So when I went in there, that surprised me. So that's why I kind of, if you remember the video, I said, oh, this has become a 6-level difficulty and now is a 10-level difficulty. And that was because I didn't expect that. And so when you're trying to revascularize or trying to open up some arteries, every time you see something that you didn't expect, it complicates the case. But we were able to work our way through that blockage and advance our wire through it. And now we're at the true blockage, or the main blockage, the one that got me concerned enough to have the patient come for a procedure.
So I'm gonna try a little bit.
So I'm still working through it. You can see my wire is not going through. It's just kind of buckling. That's what the lesion looks like. It's just,
Either find out.
actually, I'm going to go back a little bit just to show you if I can get it back here.
You can either find out or F around. Let's do another half an hour.
Okay. Sorry, guys. Okay, so right there, you can see my, the artery. This is not a normal looking artery. I might actually not be in the artery here. It might be kind of like right outside the artery, but nothing is flowing. When you inject some dye, you should see good flow. And I want you to burn this picture in your head because I'm going to show you what a normal I'm going to show you what the artery looks like after I fix it. You're supposed to see an artery go all the way from the top to the bottom with flow all the way down when I inject. And it should be smooth, nice, smooth arteries, but I'm seeing nothing here. Sorry, guys.
You can either find out or F around. Let's do another half an hour. Have what? Oh, yeah, we're probably not gonna use that. That's a good thinking. Yeah. And right now, we're trying to, so we hit a roadblock. We passed the first roadblock. And now this is the second roadblock.
So basically, what I'm trying to say is that we hit a roadblock, and when we hit a roadblock on a road, you know, and we can't get past it, what we try to do is we try to get to the other side of the road, right? So in order for me to open the road up, if I can't get through that first blockage, I have to find a way to get to the other side of the road, and then I can try to connect the dots. So right now, I'm getting access in kind of like the groin area, and I'm gonna kind of go up and over and get to the other side of the road so I can see both sides. I can see how far or how long this blockage is, how far I am. It helps me just kind of assess and figure out ways to troubleshoot this blockage to get it open.
curve here. No, probably not. Okay, let's. I think I want a stiff glide actually.
So I'm just like talking through the
Okay, so
different
when I call
tools
for
you
something,
use.
open it, right?
I'm asking for
Going out,
different things.
contrast. Let's see what we're working with here.
So right now, I'm injecting from the top now. So I'm injecting from the other side of the road,
Level has come
and
down to 6.
just trying to assess the anatomy.
Okay, ready?
So I'm getting closer and closer to where I need to be
Ready.
at this point.
All right, switch.
Remember, this artery is blocked, and whenever you have a blocked artery, some doctors are quick to send you to surgery. You don't need major surgery for this. You just need to have someone that knows how to open up arteries in an outpatient setting. This procedure was done in my clinic. It's outpatient. Patients go home the same day. Very minimal sedation is needed, so it's well tolerated. But a lot of times when patients don't know, so doctors say, well, you need major surgery, but you actually most times don't. We do these cases all the time, and
Okay, all right.
you just need kind of like a skill set to do it.
Oh, look, see? Ha ha ha. Okay, wire out. Good, 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 good. Okay, so now let's.
Okay, so I'm gonna pause it here. So now here you have this artery here coming down. You can see it's kind of like crooked and just has, it just doesn't look normal. It looks ugly looking. Well, we're not born that way, right? When I inject an artery, it's supposed to be smooth. It's supposed to be long, straight. It's supposed to be smooth. And here I see all these kind of like, it just doesn't look smooth. And then it stops here. It stops here. And then you see these side branches. Think about these as side roads, right? So whenever if you're going down the highway and there's a block on the highway, there are these side roads you can get off. Well, if you're going to Miami from, I don't know, Chicago, it's gonna take you a long time. You may never get to Miami if you use side roads, right? You need the main highway. So the main highway here is blocked and we need to get that open, or else this patient is at risk to lose his leg.
He's trying to sue Kendrick Lamar.
Okay, don't mind me. We talk about music all the time. I just love talking about music. We love listening to music. I hum all the time, as you can clearly see. I left a lot of this stuff in because that's just me, and I don't want to lie to you about what to expect if we ever meet. So now that's a balloon that I just opened up right there. We call that angioplasty. It's a balloon that we use to kind of open up that blood vessel. So I'm opening up a portion of that blood vessel. So I came from the bottom and I'm up here. I'm coming from the top, I'm up here. I have this distance to go, and it looks close, but it's not that close because because I'm actually around the vessel. The vessel is so calcified that I have to go around it. And I don't know how to explain it. I'm just kind of around the vessel. So it's like I'm creating kind of like a new path. And that's the critical portion. That's the part that makes people give up on these kind of cases, or makes doctors that are not used to this give up on these cases, because they don't know how to get around the vessel.
Is the rate limiting step right here. Because I'm telling you.
Yeah, my nurses, they're very sassy. So right here, I'm still working my way. You can see I'm getting closer and closer, and
are here. Okay, so we're going to balloon here.
So that device is, I'm cranking up the balloon, and you can see I'm trying to get these to touch. You can see that distance. I'm still not touching, but it's a feel thing. And then now I was able to get my wire down, as you can see. So remember what I said before, once I get my wire down, I can do whatever I want with that vessel. So now that my wire is down, I can do whatever. So right now I'm gonna put an ultrasound inside the artery so I can see what's going on inside the artery. And that would tell me, Am I calcified? Am I blocked? Am I inside the vessel? Am I outside the vessel or the artery? Am I subintimal? It just tells me, it gives me a feel for what's going on. Here, I'm going to pause it here because this right here is my catheter. That's the artery, and I'm inside the artery. And you see where it becomes elliptical shaped? That just shows me that I went around the artery. I'm still within the artery, the actual artery lumen, but I'm kind of like around like the side of that calcification. It's hard to explain. I'm sorry guys, but it's just, you just have to believe me. We're kind of around it. So now I've created a new path, and the only way to kind of keep this path open is to place a stent. So we're going to place a stent at some point.
Okay, let's go on.
So right now I'm kind of, that sound you heard, that was the laser. I was using it to kind of clean up some of the plaque that was under, like kind of like below the knee. Because I'm not stenting that area, so I want to kind of clean it up, and then at this point we start using a balloon to open up all the entire blood vessel, the entire artery from the groin down to the foot. We're just doing balloon work.
Because whenever we have an occlusion and we can't go through the actual lumen of the vessel, we go around it. And if you go around it,
I'm just explaining the same thing I just told you. So right now, you can see my balloon is right there. So I'm just reconstructing the artery. And again, we're doing this with a tiny little pinhole incision. No big incisions, no big surgeries, tiny little incision, almost like an IV.
Okay, so I think we're in the same plane. Yeah, we're in the same plane the whole way through. Okay, all right. Let's put Supera through the bottom.
So right now we're stenting. As you can see, we stented, and you can see kind of remember how I talked about that blood vessel that just kind of stopped there, and I came from the top and it kind of stopped there, and there's these wiry little vessels, side branches there. But look, now you don't see that. Now you see I injected some dye, and there's nice flow all the way down. And that's what you want to see. This is how you save people from getting amputations and losing their legs. This is how you get them off from pain. People are diabetic and they have pain, or they have heavy smoking, or whatever the case might be, and they have pain, or peripheral artery disease. This is how you solve the problem. You don't need major surgery for this.
Now we need to finish the bottom.
So now I've finished the top part. Now I'm gonna work a little bit on the bottom part. That first part I told you that was abnormal.
Pressure was burst. That looks like poo-poo.
Okay, so right here, I'm showing you, remember, this is what happened, this is what we saw the first time when we actually injected from the foot. And you can see these vessels, they're just kind of all over the place. It stops here, and there's one branch here, and there's just some stuff. You want straight vessels, straight blood vessels. And so we're gonna inject some dye.
Right, okay.
So you can watch this screen.
Let's see if we did better. Can I have some contrast, please? Okay,
so I'm injecting some dye.
Let's see.
And you could see kind of, look at this guy. You can see it all the way to the top. And I'm sorry, this is not the best image, but you can see that guy going all the way to the top. There's another blood vessel kind of like we fixed that coming down this way. And then this branch vessel, you don't even see it anymore because it's a branch. And then you can now see this guy coming all the way from the top to the bottom. So we had to reconstruct the entire thing. And this was a case, took us about an hour and a half to do. And it's definitely beneficial for this particular patient. So thank you guys. Until next time.